Hello and welcome to the Imprint Weekly Podcast. I'm John Kelly, Senior Editor of The Imprint, a daily news site covering child welfare and youth justice around the country. You can read all of our coverage at imprintnews.org or check us out on Facebook or Twitter at The Imprint News. You can also sign up on our homepage for our free weekly and monthly newsletters. And for professionals in child welfare and youth justice, subscribe to our Youth Services Insider section for a closer look at news on business policy and practice. The Imprint Weekly Podcast is also a member of the Safe Camp Audio Network. You can check out our show page and all of Safe Camp's other great podcasts at safecampaudio.org on the web or at Safe Camp Audio on social media. On this week's podcast, Mike Shaver, CEO of Brightpoint, a major family services provider in Illinois, and Will Schneider, a researcher at the University of Illinois School of Social Work and the Children and Family Research Center, are going to join us to discuss a new program called Empower Parenting with Resources. I think it's just kind of shorthanded to Empower, though. So through Empower, Brightpoint and Schneider's Research Center intend to study the impact of guaranteed income as a child welfare intervention component. So we talked about the plan for this test drive of guaranteed income sort of within the child welfare framework, how it's going to be measured, what both Mike and Will think would be a win in this space and what that would look like. And then we talked to Schneider a little bit about the recent research and in terms of guaranteed income overall and what it tells him about this as an experiment. Before we get started and go to the interview, a quick pitch for our annual News Match campaign here at the Imprint and Fostering Media Connections. It's that time of year where nonprofit journalism organizations are looking to maximize giving through News Match, and we are no exception to that. If you enjoy this podcast or the great work that our reporters do at the Imprint and at Fostering Families Today, please consider making a donation. If you do this during these News Match months, your donation is going to get doubled. Fostering Media Connections is very lucky to have some terrific philanthropic supporters, our advertisers, our sponsors, subscribers to Youth Services Insider that really all help make this organization go. But we cannot do it without donors like you who read our stuff, listen to our podcasts, attend our online events, and everything else. So please consider giving a donation, whatever you can. It is easy to make one at imprintnews.org/donate. All right, without further ado, here is our conversation with Mike Shaver and Will Schneider. All right, we are joined today by Mike Shaver, CEO of Brightpoint, which you may have heard of previously as Children's Home and Aid, a major family services provider in Illinois, and Will Schneider, a researcher at the University of Illinois School of Social Work and the Children and Family Research Center. They're here to talk about a new experiment in guaranteed income that both parties will be undertaking over the next few years. So Mike and Will, thank you for joining us on the Imprint Weekly Podcast.
Thanks for having us.
Yeah, thanks so much.
Before we get into the weighty topic of guaranteed income and child well-being, let's get these guys to know you a little bit. Each of you has to give me at least one favorite. The categories are TV show, movie, book, musical group, or sports team. Will, I'm picking you to go first. Lead off. What do you got for the people?
Well, I may work at the University of Illinois, but I'm a Michigan alum. So I'm a diehard Michigan sports fan, Michigan football in particular.
All right. Michigan sports. Mike, what do you got?
I'll go TV. Favorite TV show, best TV show in history, in my opinion, The Wire. HBO's The Wire.
Can't go wrong with The Wire. So the project is called Empower Parenting with Resources, or just kind of Empower for shorthand, I guess. Mike, Brightpoint does, a number of things within the child welfare space. Foster care is one of them, but this project involves another group of 800 families, right, that are referred to you, but without any family separation involved in their case. Is that about right?
That's right. That's exactly right. In the state of Illinois, we call it Intact Family Services.
Okay. So can you basically, I know that varies from state to state. So what does that mean? That they come to you with sort of the services that Brightpoint is going to deliver are necessary Like it's like these are things you have to do in order to not face a family separation.
Yeah, I mean, I think the general philosophy is that most of the families who come to us through Intact Family Services have an indicated case of maltreatment. Most of them neglect. And the determination has been made by Child Protective Services, which is operated by the Illinois Department of Children and Family Services, that a removal isn't warranted, isn't necessary. So they refer these families to community-based organizations like Brightpoint for services. And usually what it involves is sitting down, working with the family, understanding what the circumstance was that got them on the radar for Intact Family Services, and then developing a safety plan. Here are kind of the things we're going to manage in order to close out the case. The typical duration of an Intact Family case is open generally about 6 months, sometimes longer. And I would say that the majority of the cases we deal with, we typically close those cases in 6 months without a removal. We hover anywhere from 5% of those cases we serve, resulting in a removal eventually during where 95% of them we're able to close the case out safely.
Gotcha. Okay, so as I set this up, I described it as an experiment guaranteed income. So, of course, part of the project of Empower will be to provide that. Can you tell us a little bit more just about what the plan is? What are families getting, maybe in addition? How do the determinations of, what amount of money and over how long a period of time? I guess either one of you can feel free to kind of give us the skinny on sort of how it'll all play out.
Yeah, let me defer to Will on this. I think it's great to lean into him because he really has been the thought leader around how we design sort of the test around guaranteed basic income in intact families in Illinois.
Yeah, no, I appreciate that. It's a big study. So we'll randomize about 800 families over a number of months. Half of the families will receive a unconditional cash gift, a basic income each month for 12 months. The amount will vary. So that's a little bit different from prior guaranteed income studies. We're social workers, we're shooting for equity. And so the amount will vary based on family size and local cost of living. So those families will receive the cash gift each month plus the usual services that Brightpoint provides. The control group will only receive the usual services. And then in addition to using administrative data from Illinois to look at outcomes and look at the effects, we'll also conduct surveys with both treatment and control, qualitative interviews with treatment and control, and a whole range of focus groups with Brightpoint caseworkers to understand their perceptions of the role of poverty in child maltreatment.
Okay, so if I'm hearing that right, there's 800 families that are in this group, and half are going to get the guaranteed income plus whatever services Brightpoint feels is suitable to their case. And then the other 400 are only going to get Brightpoint services. And that's all taking place over the course of a 12-month period. That's how long it is.
They'll get cash for 12 months. We'll randomize new cases each month as Brightpoint receives them from Child Protective Services.
Got you. Okay. Will, I want to get back to some more about how you're going to evaluate this and study it. One very wonky question for you, Mike, before we do that, which I do think will be of interest to some of our listeners, and that is how this thing is financed. Because if I understand correctly and remember from our conversations about this, sort of as you guys were building it, you and Brightpoint and Illinois DCFS believe that federal funds from Title IV can play a role here and be part of the equation. Is that right?
There is certainly an opportunity on the research side for them to explore that. Will and his team has been really intentional about thinking about how we do this work in a way that fits this as an intervention that is funded through the Family First Prevention Services Act. But having said that, let me just be clear. The Illinois Department of Children and Family Services is the entity sort of stepping up to provide the dollars for the actual cash assistance. And that is a huge credit to that leadership team over there. As I know I've shared with you, John, Will and I have been talking about this, exploring this question, really going all the way back to 2020, trying to figure out a way to make this work. It was easy to sort of assemble people interested in the research questions. Where we consistently ran into challenges with philanthropy was finding someone who would sort of step up and say, hey, we'll provide the income, the guaranteed income. So how the Department of Children and Family Services is actually sort of paying that, what they're thinking about in the back end in claiming, honestly, I don't think that was an issue. They figured out how to fund this, and I'm guessing that it's through general revenue funds, but we've always committed as part of our partnership with the Department of Children and Family Services that we'd be pretty intentional about doing our research, asking the questions, building the intervention in a way that would allow us to eventually submit this as part of the clearinghouse to get it as a promising or evidence-based practice that could be under FFPSA.
Okay, so I'm glad you said that, because I wanted to be clear when you said earlier that this is part of the Family First Act. You're aiming for this to be something that could be included. It's not currently something that is fundable under it. Is that right? Am I understanding that right?
Yeah, let me not get over my skis too much. No,
I know it's hard.
Cannot currently under FFPSA the federal government to reimburse you for cash assistance to families in intact. So I'm fairly certain of that. However, there are dollars available under FFPSA for research to do evaluation, to do some of the testing, to build a curriculum, et cetera. There are monies available to do that, to sort of test these ideas. What I am 100% on is just sort of out of my wheelhouse is knowing exactly how the Illinois Department of Children and Family Services structured this in a way, because largely the research is being funded through private philanthropy, although the department has made some investments in the infrastructure necessary on Brightpoint side to work with the Child and Family Research Center at the University of Illinois to do the work.
Okay, so let's talk about that work. Will, you're going to be responsible along with a host of others. I know Meg Feely at the University of Connecticut. Tell people what the outcomes are that you are going to track and how that tracking will take place. I know you got to it a little bit, but just lay it out for people. What all is involved with sort of studying these families and how the cash has an impact, if at all?
Yeah. So the Children and Family Research Center here at School of Social Work at Illinois works closely with Illinois DCFS in a lot of ways. And part of that relationship is that we house the Illinois DCFS administrative data. So our primary outcomes are going to be measured using that administrative data. And that's great. It really allows us to get a real solid handle on exactly what happens to the families in each of these groups. You know, in Illinois, about 15% of intact families will come back with another substantiated case within 12 months. And so one of the things we really want to know with this work is, are we decreasing that number? Is it the case that some percentage of those families come back and a little bit of cash support each month significantly reduce the number of families who come back to the system? And then we also want to know kind of the outcomes you would imagine about child welfare, about allocations and substantiations, about protective custody and out-of-home placements. And so through all of that, we can be measured through the administrative data. But we also want to know more. We want to know, how does anti-poverty services work in reducing child welfare involvement? So is it just that parents have more money or more time through having more money to care for kids and buy the things they need? Or are there other pathways? Is it reducing parental stress, parental depression, household conflict? And so through our surveys and qualitative work, we'll hope to gather more information about these potential mechanisms. How exactly does cash work to reduce maltreatment?
Mike, just on a real world answer level to this. So Will kind of laid out sort of the parameters as far as evaluation, but just as a child welfare leader, what's your sense of what success looks like? What's the sort of fill in the blank to, like, it is worth the expenditure because this happened for the families?
Yeah. I think it's a great way to think about this. First of all, I just want to say that I think where Will and I have consistently been aligned on this is that we have a lot of theories out there, right? And really some good preliminary data that says, if you're looking at this from a root cause perspective, it's hard to ignore the effects of poverty on child maltreatment, right? What is a little less understood is the point at which that financial instability really does become child maltreatment that warrants a state intervention. So, in my career in child welfare, I have seen sort of both extremes, right? I have actually seen placement cases where you review a history and you look at the history of their involvement with the department and you say, wow, a different kind of intervention at this point could have really sort of solved the problem. And a lot of that just has to do with what we also see in our practice is this kind of cascading, right? Where someone has a major problem in terms of their car, it interferes with their ability to get to work. They then lose access to childcare, and then it starts that family on a spiral. For us, we think that the benefit is if you're looking at it just purely from the outcomes in the perspective of children who are caught up in the foster care system, there's no question that kids fare better, even kids facing similar challenges when they remain in their homes over time than kids in a comparative group who land in the foster care system and spend some amount of time there. So we know there's a benefit for kids and for families, and that there are costs associated with family separation. But there's also a really compelling economic argument to be made here. And recently, Brightpoint, through our policy center, the Alquist Center, published a paper sort of looking at the relationship between financial instability and family instability. And the reality is that when a child is placed in foster care, the costs, right, the costs to the public go up significantly, right? As much as 25 times the cost, depending on how long a child is in care. So it seems to me there's an important policy question and an important taxpayer question to understand whether a little bit of assistance in the front end can drive down sort of costs and also have, I think, the material advantage, in fact, the most important advantage of having much better results for kids. The reality, those of us who've been in practice for a while, we sort of recognize that when the root causes are related to economic and financial insecurity, once that child and family is actually in the foster care system, the child welfare system is not equipped with a set of interventions to address those underlying root causes. So this becomes a real important way of testing at the very front part of the system, the degree to which even a little bit of assistance can lend itself to greater family stability and actually reduce repeat maltreatment and importantly, the likelihood or the risk of a child actually being placed in the foster care system.
Yeah, and I think that, if I'm understanding it right, kind of stands out about this as a guaranteed income project versus other ones. Obviously, there's a lot of this going on, and a lot of it is geared towards studying somewhat at a population level. Does guaranteed income prevent X, Y, and Z, or do X, Y, and Z? And then I think there's maybe some projects around the country that are more aimed at, like, there's contact with child welfare, but maybe not an involvement. You guys are really testing cash as a tool in the toolbox for an intervention, right? I mean, that's sort of novel compared to the other ones, Will.
I think that's exactly right. Yeah. And I think this relates to this question and relates to what Mike was just talking about. I think in child welfare, this argument about the role of poverty, or not argument, but discussion about the role of poverty in child welfare that's going on, for Meg and I, it's a big question. And I think too often we think about the role of poverty in child welfare as measured by child welfare outcomes. Mm-hmm. So, lack of adequate nutrition, lack of housing, the child doesn't have a winter coat. We think, okay, well, those are poverty. And I think we would argue that that's the wrong way of thinking about it. We have to think about poverty as a broader predictor of a whole range of possible child welfare outcomes, not predicating it on particular outcomes that we think are poverty a priori. Yeah. And so if you think about it that way, I think it becomes a kind of a more systemic problem, right? It's not just parents don't have enough money to buy a winter coat. It's poverty affects a whole range of things, not just the ability to buy things for your child, but the ability to make decisions, the sound decision making, right? There's a whole host of research on poverty and cognitive load. Poverty affects your ability to parent effectively. So by pulling in research on poverty from other fields, social work and sociology and economics, I think we have to think about how can poverty be affecting not just these concrete things about outcomes for child welfare, nutrition and housing, for example, but that it may be affecting a whole broader range of even more common types of maltreatment and types of neglect that we've kind of, I don't know, by default said those aren't poverty, when maybe actually they are, or maybe they're closely related. And as you said, caseworkers don't have the tools to address that part.
Mike, you want to add anything there?
Yeah, I do agree with that. I think Will's got it exactly right. I think that is why what we have been most excited about is the ability to lend greater insights to this, because I do think, as I sit at tables with my colleagues, I think Will's accurately characterize what can sometimes be, a real seduction, right, for folks that says, hey, if we could just eliminate this problem, wow, we would be set. But not recognizing that it's a little more complicated. And I think that's when we think about it at the Alquist Center for Policy, Practice, and Innovation here at Brightpoint, we really do look to, there are a number of public policies that I think this research could have a profound impact on. And so I'm just sort of excited about the opportunity to take a large scale research project like this. It sort of meets the highest of expectations in terms of it being a randomized control trial, and test what I mean, well, I don't know if you'd agree with this, but my mind goes to this idea of really understanding how does scarcity of resources, whatever they are, how does that affect the decision making that parents have at their option. And we're fond of saying something here at Brightpoint that we don't see that the decisions that parents who wind up in our intact program or our foster care program, that they have made bad decisions. We tend to see it as they haven't had a range of good decisions to make when they're confronted with things like, I lose my childcare, I lose my housing, et cetera. There are just not an array of good decisions that face them that sometimes get them in this dynamic where they come to the attention of Child Protective Services through a teacher, a health professional, something like that. And so it's really going to be exciting to test what those assumptions are, and then more specifically, get insight into what interventions could make a real difference.
Hi, everyone. It's journalist Lisa Ling, and I'm sure you will agree that it is so important for there to be good, trustworthy journalism on children and families, and nobody does that better than The Imprint. I am such a devotee of The Imprint, and I listen to The Imprint Weekly podcast because it is so comprehensive and so substantive, and it is by far the best news source for anyone interested in critical issues like foster care, juvenile justice, youth homelessness, and so much more. During this holiday season of giving, I hope you'll consider donating to The Imprint. If you do so between now and the end of the year, your donation will be doubled thanks to the National Newsmatch campaign. To give is so easy. Go to imprintnews.org/donate. That's imprintnews.org/donate. Thank you so much.
Will, I wouldn't be doing our listeners a service if I only asked you about this, because your research on this goes kind of well beyond just this project. I will drop a link to anybody that's interested. Our reporter, Michael Fitzgerald, interviewed you at length about some of the work you're doing on just generally the interaction between money and child well-being on a lot of different levels. So open-ended question first, and then I kind of wanted to ask you about a particular piece of research. But so far, what has your research surfaced? What are we most sure about, and what are we less sure about at this point in terms of how, direct cash assistance impacts child well-being and safety?
That's a great question. In many ways, this is not a new idea. I think, if we can go back at least to the early mid-70s, when researchers were pretty confident that poverty was related to maltreatment and neglect in particular. It came up in testimony during CAPTA, right, and wasn't able to be included in that legislation. But we thought we knew then. the real restriction in research has been that we haven't been able to do randomized control trials. So, from the 70s through to the 2000s, I think what we've had is observational research, and that adds incredible value, right? We've learned a lot through that type of research. Over the last decade or so, we've seen a real kind of burgeoning research body using quasi-experimental methods. So it's not randomized, but it's akin to it. And so that research is really drawn on random variation of policy. So if you live in one state that has a more generous earned income tax credit versus one state that doesn't, well, we see that in the more generous state, there's less neglect. And so that's informative, and it goes a long way towards telling us there's a causal story between poverty and neglect. This new spate of studies, ours and similar studies in New York State, are, I think, the first really to look at this question in a truly causal way using randomized control trials. And I think we'll learn a lot. What I think we know or feel pretty confident about at this point is that poverty is certainly a predictor of child neglect. We don't know exactly what those pathways are. We don't know if it's simply that you can't afford the things you need, or if it has other effects on family and child well-being and on parenting practices or decision-making. And those are important questions, I think. And I think we're starting to learn that more work may not be the answer. So Meg Feely and I and a doctoral student here named Jihei Kang recently published a paper looking at the kind of trade-off for low-income mothers between not enough income and not enough time. And we found that there's kind of this U-shape, that when low-income moms work a lot but don't make a lot of money, there's more neglect. And when low-income moms work not enough and there's not enough money, there's also more neglect. And it's hard to find that kind of sweet spot of work and cash and time available to parent effectively, what Meg and I call safe and consistent care. And that's kind of one of the things that I think is really important is thinking about how we think about neglect. So Meg often gives the analogy, if you're at a pool with your kids and they're running, the lifeguard yells, "Don't run, walk." And that's what we do for abuse, right? We tell parents, don't do that, do this. But when it comes to neglect, I think often we're just yelling, don't run. We're not telling them what to do instead because we don't have the tools to give them something to do instead. And so I think as we move more towards causal research that I think policymakers will be more likely to pay attention to, we'll increasingly learn that anti-poverty services are really important in reducing neglect, but they may not be the be-all end-all. It may not be that we can wipe out traditional services and just give people money. In fact, I think it's pretty unlikely. That in reality, cash is really a missing piece. And it may be that cash allows people to take better advantage of traditional services. They can make it to all 6 parenting classes instead of only 2 and get more out of it. It may be that it helps to stabilize parents who are living in precarious situations, to just help them get back on their feet. And that may be enough. So I think increasingly we know that poverty is linked to neglect, but we need to know more about exactly what those pathways look like, and given that, exactly how to design effective cash intervention programs. How much, for how long, and when in the system.
I wanted to ask you about one particular, more population level experiment that is out with some of their findings. This is from the Open Research Project that provided the 1,000 a month to, a 1,000 person treatment group. So pretty big. Your guys' is as well. That study found a pretty slight reduction, honestly, in work and work income. No sustained change in health, although, some notable increase in entrepreneurship among the participants. This is obviously, like I said, more population level. It's not a child welfare related study or anything like that, but I'm sure that you are familiar with the findings here. I'm curious how that resonated with you. For a layman like me, that kind of came across as like, this is one of the bigger experiments, and that's kind of a meh finding so far.
Well, they think the evidence on guaranteed basic income has been in some ways mixed. But I do really think what distinguishes our program of research versus some of these others, as you're saying, is population versus targeted in some ways. But also, and I'm not going to cast aspersions on other projects I'm not involved in. I think ours is really theory driven. We're working here on 40 years of theory and preliminary research about why cash should matter for these particular outcomes. I don't want to speak too soon, but I feel pretty confident that we've got good reason to think we'll find effects. Open research, that project, I think in many ways they are very excited about the research. They should be very excited about their findings, because one of the things they really wanted to know was, as technology develops, can people work less and start new businesses? And they can, right? And so in many ways, if we're inclined to think about guaranteed basic income as poverty fighting, but there's a whole sector of kind of tech world that thinks about it as the future. When AI takes all of our jobs, what will we do?
Which we all try not to think about.
Yeah.
Will's a young lad, but me and Mike are like, can we just get to the finish line before we lose our jobs? No, I think that's why I asked Will, because I just think, it really strikes me as look, on some level, all these discussions are political. And when you're talking about the proposition of something universal or broad and population-based in the space of income assistance, it's a hard sell. And hard sells need very strong arguments. And so I agree with you. I think the entrepreneurship thing is significant and will be more significant as we move into a new world. But I guess I felt like reading through the findings, I'm like, this is not going to get it done if people are hoping for, that universal. At the same time, I think that, measuring cash assistance as a tool for like child welfare or a particular sector is less popular. I think maybe, if we're being honest, there's probably people that will be squeamish about that or have some qualms about, well, we're going to do this once people get roped into a system and not before. But it just is the case that it'll be a little easier to pinpoint the impact. And it sounds from you, what you're saying, like you think you're very bullish that you will find some very positive effects from it.
Yeah, I think that's right. And I think, I think you're exactly right in that some people are squeamish about this idea, right? I mean, hey, the expanded child tax credit cut child poverty nearly in half, and we still got rid of it, right? And so, I think that's always going to be a debate. I think the case I would make is that these are really vulnerable families who are in many cases desperately in need of services. And why not try a service that we have pretty good reason to think will really be effective? I think a ton of credit goes to Illinois DCFS for being willing to do that, for saying, okay, our mission here is to serve these families. And if we think this might work, we've got to try it.
The project is called Empower. Can I get your guys' commitment to come back when you got some results and we can talk about them, good or bad?
Absolutely.
Yeah, definitely.
Sounds good. All right, Mike Shaver of Brightpoint, Will Schneider of the University of Illinois School of Social Work and Children and Family Research Center. Thank you guys for joining us on the Imprint Weekly Podcast.
Thanks, John.
Thank you so much.
Thanks to Mike Shaver of Brightpoint and Will Schneider of the University of Illinois School of Social Work for joining us today. The Imprint Weekly Podcast is a production of the Safe Camp Audio Network, which is a division of Fostering Media Connections. Please visit safecampaudio.org on the web or at safecampaudio on all major social media. This podcast is produced and mixed by Christine Onjoko with music by Luke Giroux and Cyrus Elliott. If you enjoyed this episode, we would love it if you'd consider subscribing or giving us a 5-star rating on Apple, Spotify, or wherever you download your podcasts. We would greatly appreciate if you consider supporting our work here on the podcast and in print. Small donations from our listeners and readers go a long way towards helping us grow and cover more great stories in child welfare and youth justice. To support us, very easy, just visit imprintnews.org/donate. You can follow The Imprint on Twitter and Facebook by searching the handle @TheImprintNews, and you can visit us on the web at imprintnews.org. You can always get us over email at tips@imprintnews.org. I'm John Kelly, and we'll see you next week.